Hey guys, we're doing another doctor series today, and I'm really excited. I have a wonderful guest on, Dr. Pamela Hong, and she is all the way from San Diego, and she works as a podiatrist. And we're really excited to have her today. So thanks for coming on the show. Well, let's jump in. I really just wanted to talk to you a bit more about what you've been going through with COVID, and also if we can kind of start with your history. So share with us why you decided to become a doctor, and specifically in podiatry.
So yes, I'll start off with why I wanted to go into podiatry to begin with. So I've always wanted to, I was always pre-med, like growing up I knew I wanted to be a doctor. It wasn't until college, I went to UCLA for undergrad, that I really kind of decided exactly what specialty I was more interested in. Luckily, UCLA is a big research institute with a really good medical school and hospital attached to it. So I was able to shadow various specialties while I was there. The UCLA podiatry group was a group of podiatrists that I just so happened to shadow during my time as a third year student. And I really enjoyed the practice that they had. Most of the podiatrists would go in seeing patients and with X issue, right? And most of the time they were able to resolve that issue almost immediately. And most of the patients were very thankful, and that gratifying feeling of being able to solve a problem then and there was something that I truly valued. And I still value that to this day. Of course, you have patients that, you're going to see long term because certain issues will not be resolved within that one visit. But for the most part, there's a lot of patients that we see that we can easily, mend a problem then and there, which is very gratifying. Podiatry encompasses so many different fields: sports medicine, dermatology, pediatrics, geriatrics, trauma. We see almost everything that you could think of related to the foot and ankle. So it's really all encompassing. It really keeps you on your toes. So it's really nice to have that, every day you're seeing different patients of various issues, and keeps things interesting. It's very hands-on. I love surgery. That's also another huge aspect about podiatry as a surgical podiatrist, is being in the operating room and with patients that have, pre-op pain level of 10 out of 10 or higher. And then after surgery, the goal is obviously to provide pain relief. And most of them definitely do a lot better. And so having that also gratifying feeling that your surgeries are, a great outcome to a patient's lifestyle and quality of life is huge. So yeah.
Absolutely. And I love the fact that you mentioned you really enjoy being a surgeon. Can you share with us more about that? What is the feeling you get when you're entering a surgery? How do you prepare to go into, I guess, the battlefield?
So yeah, in the beginning when I first started, of course, it was a little nerve-wracking being on my own. As a resident, you had your guidance, your attending, who is, had a certain plan with the procedure, and you were there as an assistant and to learn and everything. When, I started on my own, I graduated residency in 2017. So that was the time when I started out where I was in the operating room, and I was the boss, this is my field. I call the shots. And, if anything goes wrong, it's up to me to call, to really dictate what we should do next. And it can be stressful. It's really important to, plan each surgery accordingly prior to the day of surgery, so that if you run into any problems or issues, you're able to troubleshoot those issues while you're, operating. Most of the time things go smoothly, and, it's a great day in the OR. But other times there are a lot of patients with, as you can imagine, everyone has different feet. So the feet is a very small aspect where the anatomy is very small and you're working in tight spaces. So things can, don't go as expected while you're in the surgery, but with proper training and with proper planning, you're able to kind of troubleshoot and kind of go from there. And that's kind of what as much as I don't like it because it's stressful, it is gratifying and it's a great learning experience, and you're always learning. And that's one of the greatest things about practicing as a physician and a surgeon is that you're constantly learning different techniques. You're always learning from previous mistakes or, from ex-patient. And it really, keeps me going.
Yeah, definitely. And in terms of when you have to tell your patient that they need to have a surgery, what has been your tactic in terms of relating to them emotionally, as that's like a huge amount of information and a change that they're going to be having to go through? How do you kind of calm them down, and what are some of your tactics to speak with your patients?
So most of my patients, if we're talking about elective surgeries, most of the patients are choosing to proceed with surgery. And so at that point, we should have already had prior discussions about conservative management, right? That's one of my biggest thing is I always tell patients that I would never, proceed with surgery unless you've exhausted all conservative measures. And no matter what we do, you're still having significant amount of pain in your feet that is affecting your daily activities of life. So when patients hear that, they kind of like recollect and like really ask themselves, like, have I exhausted everything? I am sick and tired of being, in pain all the time, and there doesn't seem to be anything that can resolve this issue. I guess the last resort is surgery. So at that point, they're kind of ready, and most of the time patients are asking for surgery because they feel like they've exhausted everything that has been, conservative, and that's the only option that can possibly provide a method of pain relief.
Yes, definitely. And how many surgeries have you been doing while COVID has been happening? Are you still doing a lot of surgeries per week, or is that number gone down? What have you seen?
That number has gone down for sure. During like the beginning of COVID back in March, I forget what exactly which day. I think on March 6th, I believe, I had cases that were planned for the 10th, and those cases were canceled. And it wasn't until more recently in June that we started doing more elective cases, slowly picking up OR time. In terms of elective surgeries, there's a lot of ambulatory surgery centers that are still slowly opening up, with making sure that patients get tested ahead of time for COVID, making sure that we have enough staff and everyone that is trained to, with these new protocols with COVID-19 to make sure everyone is safe, not just the patient, but staff and, the surgeon that is involved in the case. In terms of non-elective cases while I'm on call, I see a lot of diabetic foot infections or like trauma while I'm on call. Those cases have to go because, they're emergent. So in terms of, on-call patients where they need an immediate surgery, those, have been going regularly as before COVID.
Yeah, definitely. And you mentioned actually in your Instagram post about being an on-call doctor, and I really enjoyed your post. It was very thorough. You tagged several other doctors too. Can you share with us more about that post specifically, and why you felt that was important to talk about that on your platform?
So not a lot of people, even within like medicine, like know exactly what we do in terms of being, while we are on call. Like a lot of even internal medicine doctors don't even know what podiatrists, what role we play in the hospital setting. Mm-hmm. And I work in a really big like hospital system where it's very integrated. All specialties work with each other, and we are actually a huge asset to the team in terms of providing that foot and ankle care for patients. There are a lot of members with diabetes, unfortunately, and there's a lot of consequences that can occur with diabetes, and especially if it's uncontrolled. And so a lot of infections that we see occur in these diabetics, or even in patients with poor blood circulation, end up getting infections or gangrene that needs to be addressed. And those are like very common. And, when we're taking call, these patients, they're really sick at that time with, pussed out foot that needs to be, taken to the operating room to have it drained and cleaned out completely. And this is, kind of a bread and butter thing that we see and do while we are on call. I think it's good that we share this information with like our colleagues and people that may be interested in the field of podiatry to know what it's like, out in practice, what you're dealing with.
Absolutely. And I'm going to kind of switch gears here, but I know we were talking before and you had found out during COVID that you're expecting. So what are you most excited about in terms of being a mom, and what has been different expecting during COVID? My sister is also expecting, so I know she's had a lot of hard times, and she's in Dallas right now where it's pretty crazy out there, and she's due in like 2 weeks. So I feel like she, a lot of things have changed, like the family, we can't go out there, and, nobody else can really be in the room and things of that nature. So what are you kind of feeling right now, and how has that been different compared to if it wasn't COVID?
Yeah. So, let's start out with like talking about when we found out. My husband and I found out before COVID-19 happened. It was like probably a week or two before, where I had my first appointment. And, first of all, they told us that he couldn't be there. So off the bat, I was like, well, that sucks. Hopefully he'll be able to be there during future appointments. And of course I understood why. But that within itself was kind of like, oh man, I wish I had my, husband to share this experience with, and then and there, especially with the first appointment, finding out that we're, actually expecting. It was a little nerve-wracking because I think it was like my second appointment a couple of weeks later, because at first, like, they were kind of unsure whether or not, I was actually progressing. So I had to get a formal ultrasound, at the main hospital a week later. They were starting to take temperatures at that time for screening purposes for COVID. And for one reason or another, I had a temperature that day. And that wasn't a good sign, because they were like nervous that I, had a fever and maybe, on my way to getting sick. I felt fine. And in my head, I was just thinking, well, I have to work still. And I wasn't planning to take any time off. And then with this whole baby that I was expecting and maybe not even progressing at that point, I was just, so many emotions were going through in my head. It was very stressful. It was a roller coaster of a ride, but the, ultrasound went well, figured out that, the baby was progressing. My temperature, I talked to my OB at the time. I was like, well, I feel just fine. Like, how about we, monitor my temperature for the next 72 hours, like every hour I'll take my temperature. If I'm, feeling any different, I'll let you know. And so we worked, that out, and luckily everything was just fine. I think it was just kind of a spook thing that I had a temperature when she measured it at the time. So we progressed to a new normal where, my husband still can't come to any of the appointments, but we've kind of modified things where I try to FaceTime him while I am with my OB, so that at least he feels like he's part of it. For a little gender reveal, I had the ultrasound tech just put our gender in an envelope so that we would find out together rather than me find out without him. Mm-hmm. So that was also another way where I tried to incorporate, having him feel that he was part of the process.
Yeah, that is really difficult. And you look great. I mean, you're obviously like glowing. I follow you on Instagram. I saw the gender reveal. I thought that was so cute. And I think that your insights can actually help a lot of like women who are working women who are wanting to plan families. So I think you can actually be a really big inspiration for women really everywhere. You may just not recognize that. So I think that's really cool. I have to just say that. And also congratulations. So what, I know this is a silly question perhaps, but are you thinking maybe your child will go into medicine? Would you encourage them?
That's a good question. I'm not sure. I mean, I honestly, I don't know. I'm definitely going to expose my child to like my line of work and my profession and everything. And I'll support them with whatever they decide to do. Like, times are changing. Like, medicine is so different from when I thought what medicine would be like. There's so many different growing fields that I didn't even know of, like growing up, with technology and everything. So I think we're going to support whatever our child decides to have a passion in.
I think that's great. I think that's great. And yeah, circling back to medicine, is there any advice you would give anybody wanting to go into the field, or any other young female doctors or doctors to be that you would share with them about their upcoming journey to that?
Yeah, like I think one of the biggest things I always knew, like I think having a true passion in something that you want to do is going to actually give you that push to get to where you want to be, right? Like if you have that passion, if you have that drive, nothing's going to stop you, right? I think the biggest thing that was very helpful for me was seeking out mentors, seeking out women, especially like that were in the same position that I want to fill in, eventually. And I knew I wanted to be eventually a married mother working. And so while I was a, student at UCLA, like that was really important to me even at that time. So I would actually like email women physicians or surgeons that were in that situation and asked how it was for them, because I knew at that point it was going to be a long road before I was going to eventually finish and get to where I wanted to be in terms of my career, and then have a family while doing it. So it was really reassuring, like hearing back from other female physicians that are able to work and have a full-time job or part-time and still have a very well-balanced life outside of work with their family and their husbands, spouses, kids. So that was really important to me, and I definitely had a lot of female physician mentors that served that role that I idolized at the time, during this process, that really helped me.
Yeah, absolutely. I think that's really good advice. Well, we're wrapping up here, so can you just share with us where we can follow you on Instagram and where we can learn more about you?
Yeah, so my Instagram account is Dr. Pam Hong, and I hope to provide more information, with regards to this medicine track, like pre-medicine or pre-podiatry track, as well as like, showing that you can work really hard, have a nice career, but also, enjoy life at the same time. Because I think it's really important to have a very well balanced lifestyle, just for sanity purposes. Your job can be stressful, but at the same time, you can have a really amazing like lifestyle outside of work as well.
All right. Well, thank you so much for that tip, and we appreciate you coming on the show today.